A recent study reveals children who deal with sleep apnea are at a much higher risk of high blood pressure as a teen than those who did not have sleep apnea when they were younger. Here to talk about the study, Dr. Chalam Mulukutla. He's a cardiologist at Las Palmas Medical Center. Dr. Mulukutla, I didn't even realize kids could experience sleep apnea, let alone that it could lead to heart problems in their teens. So tell us about these findings and why sleep apnea in children may lead to those heart issues when they're just a few years older.
Well, sleep apnea is a very common condition, and it's very common in adults. Obstructive sleep apnea is basically when people are not able to sleep at night and actually stop sleeping periodically and obstruct. Children can have this as well as adults, and there's many causes. Sometimes it can be tonsils that are very large or other causes. But specifically what was interesting in this study was that patients that had sleep apnea were 3 times more common to have hypertension, and it was in studies of patients that were between the ages of 5 to 12. There were over 400 patients in this study, and they followed them again 8 years later, and they found that these patients, those that continue to have sleep apnea, 3 times more common to have high blood pressure, which was a very surprising finding.
So why is it harmful for teens to experience high blood pressure? Does it lead to more serious problems as an adult?
Absolutely. So hypertension is a really important problem that people can have. It's known as a silent killer. It's a real common cause of problems for stroke and heart disease. These problems that, if undiagnosed, can cause problems in kids when there's 20, 30, 40, 50, or 60. So understanding what causes hypertension and the causes are really important in preventing disease. And at that age, preventative care is the most important.
So this can be corrected in teens so they don't develop heart issues or become more at risk for heart issues as they get older?
Absolutely. Obstructive sleep apnea can be due to many causes. One of them may be obesity. Eating a healthy diet would be important. Obstructive sleep apnea can also be treated with a machine that can be used at night. Over 10% of kids have obstructive sleep apnea, and half of them will outgrow it. We don't know which kids will and which kids won't. And so that's the reason that it's important to understand, to find out if your kid snores at night or has any issues when they go and check with their pediatrician during their yearly physicals.
All right, so what else should parents who are watching today know?
What I would say is this: make sure that you see your pediatrician once a year, and make sure that they check the blood pressure periodically. As the American Academy of Pediatrics has now recommended, we are checking for blood pressure and screening even for hyperlipidemia at a much younger age. Cardiovascular health starts at a younger age, and teenagers are just at risk for those problems. So the more we can keep that under control, the better we will be at preventing disease in the future.
And of course, make sure your children get a good night's sleep to begin with. Dr. Chalam Mulukutla, cardiologist with Las Palmas Medical Center, thank you so much for coming in as always.
Thank you.